So hi everyone, thank you so much for joining us today at the Apply Hub for the Becoming a Dentist talk. We're going to have a talk from who is currently the General Dental Council's head of public policy. He's been working in regulation of health and social care professionals for 17 years. He's also led education, quality assurance functions, and developed regulatory standards and policy across pharmacy, allied health, nurses, and midwives before joining the General Dental Council. So take it away.
Excellent. Thanks very much. So hi there, everybody. As has just been explained, my name is Osama Ammar. I'm the head of public policy at the General Dental Council. Unfortunately, I'm a bit of a stand-in for an actual dental professional who was due to give you this presentation. And I'm not a dentist or a dental care professional. So you'll have to forgive me slightly. Luckily for you, I do know a fair bit about dental regulation as a result of working across a number of different regulators for a few years. And in this presentation, I'm just going to give you a bit of an overview of dental regulation, let you know a bit about how the process of becoming a dentist or a dental care professional may work, and then hopefully give you an opportunity to ask any questions that you might have if you're interested in becoming a dentist or a dental care professional. So before I go into too much detail, just to give you a bit of an overview of what we'll be covering. First of all, a bit about professionalism and what being a dental professional actually means. Becoming a dental professional is about much more than just making an application. It's becoming a healthcare professional. It's about a service that is provided to members of the UK public. And there are lots of expectations that are placed upon health professionals of all types, but particularly dental professionals, as they provide their services. And I'll let you know a bit more about what that might mean. And then, because being a dental professional in the UK is multifaceted, there are lots of different types of dental professional. They do different things as well. So I'll just give you a bit of an overview of the different types of dental professionals there are and how large their numbers are in the UK. And then I'll tell you a bit more about how the GDC, the General Dental Council, actually regulates dental professionals. And that will be the point where we can talk about what the application procedures might look like, depending on where someone qualifies and the which part of our registers they're applying for as well. So as I've said, becoming a dental professional is about much more than just making an application to our register. What the professional registers are there primarily to protect the members of the UK public from the potential for harm, because dental professionals, alongside all health professionals, are exercising high levels of skill, and they also benefit from the trust that members of the public place in them. There's an inherent power dynamic between professionals and members of the public who may not know or understand what professionals are up to. And that means that there are a lot of responsibilities that dental professionals necessarily take on when they undertake their practice. And so at the GDC, we've been working for many years now to make sure that everybody understands what it means to be a professional. And it's one of the core things that we're looking for when somebody makes an application to our register. So it's not just about the knowledge and skill that someone has, but it's also about other things like their attitudes and behaviours. And those are towards members of the public, but also that goes beyond their practice potentially as well. So it's about upholding these standards in their daily lives as well as in their daily practice as well. And that means that there are lots of expectations placed on dental professionals. And one of those core expectations is how they respond when something goes wrong, and that they are engaged in a process of learning and reflection inherently as part of their professional practice as well. And that means responding to feedback and to mistakes as well. So this principle of professionalism sits at the heart of being a dentist or being a dental care professional. But what does that really mean in practice? In terms of our standards that we set for dental professionals, what primarily this means is that members of the public or patients' interests will be put first. So dentistry in the UK, slightly differently from some of the other professional contexts in which people work, takes place across an NHS and a private provision as well. And that means that we're expecting people who work in the dental professionals to put patients before their commercial interests, and also to exhibit those professional behaviours when they are at work, and also when they're not at work as well. Really importantly, the journey of learning that a professional will go through throughout their entire career never really stops. And that means that there is an expectation that once someone joins the register, that they will keep their knowledge and skills up to date. And then we set some standards for professional development, which will need to be completed every year. Another key requirement for being a professional in the UK is to be indemnified, so that when something goes wrong, members of the public have a route for recourse. And then alongside that, and we'll cover this in a bit more detail, are requirements to maintain your registration. So registration in the UK for dental professionals is an annual process. So registration lasts for 1 year, and then every year that registration needs to be retained. And at every year, that's when somebody would then pay what we call their annual retention fee, or an annual registration fee as well. So that's what in practice it means. It's about putting patients first. It's about taking responsibility for your learning. It's about behaving in the right ways that embody the trust that members of the public should have in the professions. It's about making sure that there are routes for recourse when something may go wrong in practice. And it's about making sure that you keep up with the administrative requirements of being on the register, which is annual retention as well. Now, in terms of regulated professionals in the UK, just so that you get a bit of a rundown, because we do things slightly differently in the UK compared to some other nations across the world. So we have a number of different regulated professions, and depending on where you are, you might have fewer or potentially even more regulated professions. So the professions that profession that you'll be absolutely familiar with is dentists, almost uniformly regulated in a similar way across the whole of the world. Dentists normally play the senior leadership role within a dental team, and they are providing direct services to patients. Then we have dental nurses, another important part of our professions in the UK, but they are less frequently regulated across the world. And the dental nurses play a really important role in supporting dentists and other dental professionals in their daily treatment and engaging with patients as well. We then have two professions which undertake activities which are a kind of a component of the scope of practice of dentists, again engaging directly with patients, and those are the dental hygienists and dental therapists. So dental hygienists are primarily focused on oral health and hygiene activities, but still undertaking procedures in the mouth, and dental therapists doing additional activities including extractions as well. And then we have a couple of a role called orthodontic therapist, which is a specialised part of our register. In order to be an orthodontic therapist, you have to first be another one of the registrants on our register, and then you can do some specialised training in order to become a dental therapist. And then we have two roles which are regulated in the UK. Again, this is slightly different across the world, which are dental technicians and then clinical dental technicians. And they are the ones who will make dental appliances, such as retainers or orthodontic braces, and they dental technicians can undertake repairs direct to the public, but clinical dental technicians can do a wider range of services and provide them directly to the public. And every clinical dental technician would have first trained as a dental technician as well. So those are a variety of our different professions in the UK. They tend to operate in a variety of different locations. So working for the most part in general dental practices, so on high streets, providing services directly to the public. They may work by contract to the NHS, or they may work solely in a private setting, or work in a mixed setting as well. The clinical dental technicians and the dental technicians will tend to work in laboratories rather than in a general dental practice setting as well. But as well as those roles that you familiarly might think of for dental professionals working in. There are also a huge number of different types of roles that people can undertake. So there are roles that work solely in hospitals, that's normally around specialised care. Particularly for dentists, there are opportunities to specialise even further. So that might be in the realm of 13 different specialties that exist for dentists over the course of their career. So things like orthodontics or oral surgery in particular. As I say, working across a variety of roles, including roles in professional regulation as well. And as I mentioned, one of my colleagues was due to present to you today to give you a bit of an oversight from their experience of being a dental professional. But one of the things that dental professionals also do is support the regulatory model through their activities. So we have dental professionals who are involved in consideration of concerns and also applications to our register. But there are also dental professionals who are involved in the inspection of dental practices in the UK as well. And there are a variety of other roles in the provision of services or the way in which the NHS operates that dental professionals can fulfil as well. So it's not solely a career in directly delivering clinical services if you were interested in it. There are a huge variety of different activities that a dental professional can undertake. Just to briefly give you a sense of the size of our register, so there are about 115,000 dental professionals of all kinds on our register. And the majority of those are the dental care professionals, but the dentist register itself, is about 42,000 individuals, and then the dental care professional are about 73,000. And then broken down in that, the dental nurses are the largest part of our register, and they play a role across a wide variety of settings. But then we also have a general increase in the number of registrants over time as well, and there are suggestions that there will need to be a further increase in the number of dental professionals in order to meet the demands of the UK public to provide dental services as well. So I've already covered most of this in the slides, but just to kind of outline a bit more about what we do at the GDC in order to fulfil our role, and just a bit more about what our role is. So as I've said, we're a regulator across the UK, so that's across all 4 nations of the UK, and we're regulating this very large population of professionals, and our job is to regulate the individual professionals. And we regulate them no matter where they work. So that might be in the national health services in each country, or it might be in their private provision, or it might be individuals who are working in entirely different settings as well. They are still responsible for meeting professional standards, whether they're delivering education and training or working in a completely different setting. If they're registered with us, they must meet our standards. But we're only one part of the regulatory model across the UK. And there are other components that make it up. So we are a professional regulator looking after the individuals, but there are also what we refer to as the systems regulators, who will then individually inspect and make sure that the locations and the way in which services are delivered are safe. And in England, that organisation is called the Care Quality Commission. And so we work in partnership with those organisations across the UK who will be delivering those similar functions. We will also work in partnership with other regulators who are responsible for medicines, for example, as well. Now, our role is to work on behalf of members of the public primarily. So really important thing to remember about us at the GDC is that we're not a professional body. We don't represent the professions that we regulate. In fact, we represent the interests of members of the public, and we have a duty to protect and promote the health, safety and well-being of the UK public. And we also have a duty to maintain confidence in the professions. And in the next slide, I'll outline the variety of ways in which we do that, and also talk a bit more about the routes to registration as well. And then we also have a duty to promote and maintain the standards of conduct, but also some standards, essentially standards of proficiency for the dental professions as well. And those are set out in a document known as Preparing for Practice, which are the learning outcomes that all UK training and anyone who has trained outside the UK will need to meet in order to be able to join our register. So, as I've mentioned, our role is one where we are focused on the interests of members of the public. But in order to deliver that function, we have to work with dental professionals, not against them. And we have to work pretty hard to make sure that we're setting the right standards and doing that in collaboration with the sector and understanding the realities of their practice as well. So that's what our role is. How we actually do that then is through a variety of different functions. And I'll just run through this slide to give you a sense of what some of them are. So in the UK, we are responsible for the quality of education and training of dentists and dental care professionals. And so what we do is we actually inspect courses of education, or in some cases, overseers of education, to make sure that anybody who qualifies in the UK is going to meet the right standards to be safe and effective in their practice. Now, once we've found out that someone is safe and effective in their practice, they still need to make an application to our register. But someone who is trained in the UK will just be able to tell us about where they've trained in the UK. And because we've inspected that course, we'll know that they've met our standards, and then they'll be able to join our register. There are some additional checks that we do at that point. So some things like a character reference that we ask for, and we'll also ask for payment of the registration fee and application fee at that point as well. But because we've looked at their training, we can have confidence that they're going to meet most of our standards as well. When someone is trained and qualified overseas or outside the UK, we have different processes that we use to make sure that someone is going to meet all the learning outcomes that are necessary for safe and effective practice. And the processes that we use currently vary because we still have some pieces of European legislation that have been carried over for a period of time. They vary based on where you've trained in the world, also potentially the institution that you've trained in, and they vary by which profession you're applying to. So for dentists, there are some European qualifications which continue to be recognised through to about the end of next year. So anyone with a European dentist qualification, you may be able to apply to our register through a recognised qualification route. For anybody who's trained outside of Europe, the route to registration is what we call our overseas registration exam. And that is and this is for dentists only. I'll come on to dental care professionals in a minute. For dentists, the ORE, as we call it, is a two-part exam, and an application is made to that through our website. And the first part of the exam, which is then further divided into two components, is a written exam of clinically applied knowledge and skills. And if somebody passes that exam, they're then moved on to the second stage, the second examination, which is then a practical skills assessment exam. And that is has 4 components, and it's run over the course of 3 days. So these are particularly robust assessments that we perform for dentists being able to join our register. If someone passes both parts of those, they're then able to apply to our register. Again, we will do a number of checks in addition to making sure that someone has the knowledge and skills for safe practice, but then they would be able to join our register. For dental care professionals, it's a bit different. So for any of those other titles I was talking about, the process that we use in our legislation is one where somebody makes an application for assessment of their prior qualifications and experience wherever it has been gained. And so we conduct that process by somebody making an application to us, and it's a comprehensive application and pieces of evidence that they need to apply to give us when they're making an application through this route. And it will set out where their qualifications are from, what the learning outcomes were from those qualifications. They'll be able to give us references from their employers, which will provide us with evidence of some of their clinically acquired skills. They'll be able to tell us about their CPD, but we won't necessarily rely on CPD in quite the same way as we will from somebody's primary qualification. And all of that information will be assessed by 3 professional assessors. Those assessors will make independent judgments, and then they will come together and then they will make a joint recommendation about whether someone should be registered with us based on their accumulated knowledge and qualifications as well. And that's for all of those professions that were on the list. Again, if somebody makes it through that knowledge and skill assessment that we do, we will then do some further checks, such as character references, and we'll also expect someone to pay a fee to us, and then they will be able to join our register as well. Now, when someone joins our register, as well as meeting all the knowledge and skills requirements, they will then have to meet the standards for the dental team, which are the standards for professional conduct and ethics that we set. And there's an expectation that everybody on our register will be able to meet those standards at all times. And we use those standards to ensure that the trust and confidence that members of the public have in the dental professionals is embodied in the behaviours and the actions of members of the dental profession. As well as having to meet those standards, then dental professionals, as I've mentioned, will also need to be doing continual professional development. The reason for this is that members of the public have an expectation that dental professionals will be keeping their knowledge and skills up to date. And we have a process, I won't go into details of it now, which sets out what those requirements are for an annual basis, but it includes making declarations to us about the activities, as well as on occasion submitting information to us about the activities that have been done. And what that does across those 4 things there is ensure that everybody who joins our register meets the knowledge and skills requirement, upholds those standards for safe and effective practice, but then also keeps their knowledge and skills up to date as dental practice changes over time. As all health professions, there is a kind of continuous updating to the knowledge and skills base. Now, at the bottom of that slide is a process that we use. And the reason why we've put it at the bottom is because I think sometimes people think that what regulators do is only focus on this part. And actually, in our ambition as a regulator, we want to focus on those other things which are about ensuring that our standards are met before things go wrong. But we also spend a part of our time considering concerns about dental professionals which have been raised with us. And they might be raised with us by members of the public or potentially by employers. We have to do this process to make sure that the public is protected, and what we do is that we consider any concerns that are raised with us. Again, dental professionals are involved throughout that process to help us understand what those concerns were, and we do have the powers to take action in some cases to restrict people's practice if we feel that the public safety has been compromised in any way, and that individual's fitness to practice, as we call it, has been impaired on an ongoing basis. Okay, so that's covered all the slides that I wanted to get over to you. Hopefully I've given you an introduction to the application route to becoming a dentist, a bit more of information about what it might mean to be a dentist or a dental care professional. So just checking to see if there are any questions from anybody in the last few minutes of the session.
Let's give everyone a few minutes. In the meantime, I have a question in mind that I thought of while I was listening to the talk.
Sorry, I couldn't quite make that out.
Oh, so my question is, how did the regulation for dental professionals change, or did it change in light of the COVID pandemic?
It's a really good question. So nothing in our legislative framework actually changed as a result of the pandemic. But what we did was we responded pretty quickly to the fact that dental professionals were working in an entirely new context. So one of the things that happened in the UK was that general dental practice was closed for a period of time. Until a safe way for delivery of services could be reached through a decision of the UK government, essentially. And what that meant was that there were quite a lot of dental professionals who were very uncertain about what they could do. Although we didn't set the guidance for that information, what we did was provide new information on our website to help dentists understand where to look. So we played a role in supporting people to find information. I think also there continue to be a lot of pressures on the dental sector at the moment as a result of the pandemic. So at the moment, the number of appointments that can be held is still reduced, and there's also a backlog in demand of care. And so we've been doing some research at the GDC to try and understand what that might mean, and playing a supportive role in helping the sector understand what that might mean for the future of dentistry, and also the future of regulation to support it as well. One of the things that's been talked about is about how the roles of not the dentist, but the other dental care professionals can be changed over time, and how the regulatory model might increase the scope of what dental care professionals are doing to help support increasing access for members of the public. But nothing actually changed in our legislative framework, if that makes sense. We've just started trying to adapt at the moment, but there may be changes that follow at a later date. I can see a question here.
Yeah, go ahead.
So the exams for applying for registration, so remember those are only for people who have qualified outside of the UK and currently outside of Europe, and they haven't got a dentist qualification from Europe. Those are a one-off thing, they are not annual. The annual process is called the retention process. There is no exam there, but you are expected to use an online portal to essentially confirm that your information is correct, make some declarations, and those declarations are really important because they're the way that you're confirming that you continue to meet our standards and that there is nothing that prevents you from practicing, for example. And then there's also the payment of the fee at that point as well. But there is no examination at that stage, just questions that you are asked to fill in using an online form. Any other questions about practicing dentistry in the UK? What it might be like to actually work in some of the different settings. Although I haven't done it, I have spoken to a lot of dental professionals, and I might be able to provide you with any information.
Yeah, if anyone has any questions, feel free to send them in, or if you want to DM me privately. That's happened during a few of the other sessions as well, and I checked them like 5 minutes on the end. I'm like, oh, there's like 10 questions here.
Yeah.
But we still have quite a lot of time actually. If you'd like to, do you want to go through like the different roles and what it's like working in those different sectors? I don't know very much myself about dentistry, so I'm learning as well.
Yeah, sure, no problem. And again, just caveating, I am not a dental professional and I've never done this. But what I can do is just talk a little bit more about the kinds of things that dental professionals are doing from the best of my knowledge, basically. So as I've mentioned, dentists will essentially work at as the leaders of the dental team, and they'll work with all of these different professionals. And they might be working in like a small independent private practice and be the owner of the business, or they might be working for a larger corporate structure. So some of our dental services are delivered through large private providers like Bupa, and they might be part of a larger corporation as well. And that's where the roles of dentists might move for less from delivery of care and more into quality assurance and leadership of a larger organisation rather than a small privately owned business. It looks like increasingly more people are working and more services are being delivered by the larger corporate structures than they are by those smaller independent dental providers, but those still exist in the UK as well. And so there is a sense with dentists that they might be private business owners, and they might also be delivering by contract services to the NHS as well. And those services will run across a local community. So those practices need to be really engaged with their local community and the people that they serve. And so that might mean that they need to adapt how they deliver their services to particular communities. So depending on the area, there might be higher levels of deprivation, there might be higher levels of a lack of access to dental care and a lack of understanding why dental care is important. So they might need to spend more of their time working on health promotion and on oral health promotion as well. But then in other areas, there might actually be in urban centres, there might be lots of dental practices around. And in other areas, there might be rural practices where they serve a very large community as well. What we've seen over the course of the pandemic as well is for the first time in the UK is the use of online services to act as a kind of triage for dental treatment as well. And that was something, because dentistry is very hands-on, it's very practical. That wasn't something that really used to happen before. But now there are increasing use of online triage as well. And that's been a place where some of the other dental care professional roles have been playing a role too. There's also quite a lot of outreach in dentistry, just so that you know. So that would be about going to care homes and supporting older people to maintain their oral health, but also to treat oral health matters as well. And I've been working alongside a group of people who've been trying to increase outreach into special education settings as well, working with children and young people to make sure that their oral health is maintained on a more regular basis than it currently is as well. I think one of the important things to remember about dentistry, if this is the first time that you've ever become interested in it, is that although it is a specialism related to oral health and teeth, that the oral health is absolutely crucial for general health as well. So it unlocks the potential for general health and well-being for so many people. And it's really important that it's thought of as being a central component of how someone can attain general health and well-being as well. And then just so you know, the dental technicians and clinical dental technicians, sometimes they also run their own private businesses and laboratories too. So they might be delivering their own services to members of the public directly, but they might also be a part of one of those larger corporate structures I was talking about as well, and delivering their work in that way. Again, and they can engage directly with members of the public, but there are some certain restrictions over what they can do without the input of a dentist, essentially. And then the dental therapists and dental hygienists essentially are kind of the right word is that they're kind of like autonomous professionals who are playing a role in the dental team, which is doing things that I think perhaps traditionally, many years ago, it was thought that these were reserved activities for dentists to do alone. But these roles are actually increasingly doing more and more. And there's work in the UK at the moment to actually provide dental hygienists and dental therapists with the opportunity to administer and supply some medicines as well. So that's certainly what's happening with all of the professions and across all allied health professionals generally is that over time, what they're doing compared to what their predecessors may have done is increasing, so that we can provide more and more services to members of the public at an easier pace. And then I'm afraid I don't know off the top of my head what the compulsory A-level subjects are to apply to the dental schools, but I can go and find that out and get that confirmed for you. I would expect them to be, generally speaking, science subjects rather than art subjects, but I can check that and make sure that's the case.
Yes, thank you for the answers you gave. It was very interesting. In regards to the question of the A-level subjects, if you go into any dental school, their courses, if you look at the requirements, they will all tell you which A-levels they accept. I think chemistry is one of them, but with the others, it's a bit more optional. I'm not a dental student myself, so I'm not fully informed. I'm a medical student though, so they're relatively similar. And I know for medicine, you just have to have chemistry, and they suggest biology and maths. But I know people who did chemistry, biology, and let's say an art subject, and they were fine.
And there is absolutely variation as well between the entry requirements. And what you may find is that there are routes to help people adapt into the different courses as well. Yeah, that's absolutely right, Ellie. It's really important that people start to understand that this professional group is absolutely central to healthcare for general health. I think sometimes the dental professions are overlooked for their contributions, and it's really important that that changes. I think one of the things that the pandemic has done in a positive sense is raise the profile of dentistry in the UK. The fact that dental services were closed has drawn attention, I think, to members of the public how important dentistry is for their well-being. So although there is a lot that was problematic about the pandemic, there is one thing that I think it might have been helpful to raise the profile for.
No, absolutely. I've just been DM'd a question, so I think maybe they got a little bit confused about the chat. So I'll read out, I think what might be the final question, assuming no one else has anything to ask. Okay, so the question is basically asking that as like health professionals, your conduct is looked at more closely compared to, let's say, maybe other job sectors because of the responsibility that you have towards the public. And I suppose this person's asking for more on like the public media front for the GDC. Have you seen any cases in regards to that, and what would be the expectations for dental students in regards to like their social media etiquette?
So this is a really important point, actually. So health professionals and dental professionals included within that are expected to maintain confidence in the professions, and that does mean that there are additional duties placed on health professionals that some other professions or non-professionals don't face. And I think that's something that everybody who wants to join a profession really needs to understand, that there are privileges that come with being a professional, but alongside those privileges are also responsibilities. And we have seen over the years, I say we, this is from my career across a number of different professions, not solely dentistry, that as social media has expanded and people have been living their lives more so online than previously, in some instances, rare ones, that there have been professionals who've forgotten that that is a published piece of information, and that those expectations that are placed on dental professionals can mean that you might be undermining trust and confidence in the profession as a result of your behaviours, particularly if your social media profiles happen to highlight the fact that you are a professional of a particular type, and then you say something online that is abusive, offensive, or inappropriate, essentially. Now, this is a question of personal responsibility, and it's not so much for regulators to say you mustn't be on social media, you mustn't do the following things, but instead for people to think very carefully about these things. So I'm not a health professional, but I work at a health professional regulator, and that means that I take my social media very seriously as well, and I don't post and do things and think carefully about what it is that I'm doing in that space, because we collectively have a job to do, which is to uphold confidence. The reason why that's important, and you know, it is important, is that members of the public put their trust in you, and then by proxy me, to make sure that they're going to be treated well and safely all of the time. Trust can be eroded so quickly when we behave in ways that mean that members of the public feel like that they might not get the services that they need from you, stroke me as well. And I suppose one of the things that is very clear is that when trust levels are low between patients and professionals, it means that certain things aren't done as frequently. So adherence to medicines usage, for example, when trust levels are low or understanding is low, diminishes as well. So it's really important that we do these things. We think carefully about how we behave in public to make sure that those trust levels are maintained, because it's not just a kind of an idea that it's important that there's trust. It has a real effect on what patients do and how they feel when they're being treated. And so it's really important that we do it. And then definitely just think carefully when using social media, because there are duties, there are responsibilities that professionals and people who work in regulators have towards members of the public that mean that we have to think carefully about what we say and do online, because it is a public record, and depending on what you say and do, it could be considered offensive, inappropriate, and that might be breaching that trust and confidence that we need to uphold. Any other questions?
It doesn't look like the last question and comment came in 5 minutes ago. We've got about 5 minutes left, so we're quite good for time. I have one final question myself, if that's okay.
Yeah, sure.
So during the pandemic, medical students and doctors had to deal with a lot of misinformation during the pandemic about what people said caused COVID, how to treat it, prevention, etc. And I guess I'm wondering, whether it was during COVID or just in general, what type of misinformation is there spread around dentistry or how to treat dental conditions? And what do you think budding dentists and future dentists could be doing to help mitigate those factors?
I think so. Yeah, we're living in a bit of a misinformation age, and I think it kind of falls to a variety of different organisations and also professionals to help support the public to understand where to find the truth. Essentially, there was little misinformation from what we could see that was directly applied to dentistry, but there was a lot of anxiety, and I think that we're still seeing that. in this is a personal story now. I happen to have my mum visiting at the moment, and she is very worried about going to the dentist and infection control levels there. And so I had to help her understand how well trained dental professionals are in infection control measures and how safe dental practices are for her to go and visit. And I think it's less about deliberate misinformation that, in the way that we may have seen in relation to the vaccination, and much more about a strong sense of anxiety about returning to the environments in which dental care may happen. And I think what we just need to do there is remind people again how central their oral health is to their general health, particularly people who maybe in the older generations, where their oral health is often an early sign or indicator for their general health, including things like cancer and heart disease as well. So it's less about addressing misinformation, much more about addressing a lack of confidence about returning to those environments. The other thing that our research told us was that members of the public trust no one more than their dental professionals to provide them with that confidence. So we wondered whether it was for us to do, but we found out that actually members of the public didn't really recognise our ability to reach out to them. And what we found out was that they trusted their dental professionals, the people in their community who were there to provide them with services. So I think that's how it's addressed. It's about making sure that members of the public hear those messages from the qualified people to provide it to them.
I see. Thank you so much. That's given a very interesting insight. Okay, we're coming up to time. Thank you so much for doing such an insightful talk. It was very interesting, and I certainly learned a lot myself. But thank you so much for giving up your Saturday to talk to.
No problem at all.
Like, it's been incredibly useful.
Yeah, and I'm sorry I'm not a dental professional. Hopefully next year we'll be able to front one up for you. Cool.
No worries, like, it was still incredibly useful.
Cool. Perfect. Thanks very much then.
Okay, bye-bye.
Bye.